Six, five, four, three, two, one.
Miss JF Hello, I'm a nurse who will take care of you today. My name is Parasa. What's your name?
I'm JF.
How old are you?
I'm 18 years old.
What's your weight and height?
My weight is 131.4 kilogram and my height is 162 centimeters. 2 days ago, I noticed swelling in my hand, my feet, and my face.
Anything else?
I have a frontal headache which started yesterday and has not been relieved after taking Tylenol.
I think your sign is pregnancy-induced hypertension. Hypertension is a form of a high blood pressure in pregnancy.
Is there a way to reduce swelling?
I advise you to try to sleep on your sides and elevate your toes while lying down, or if unable to sleep, can change behavior frequency to allow movement of the body and not cause compression of the uterus for the circulatory system in the body is convenience. Please allow me to make sure your vital sign to assess your symptoms.
Sure.
You have high blood pressure and your urine tests show abnormality. Please wait for the physician to come to see you.
Hello, my name is Nisha God. What the physician? What is your name?
I'm JF.
What have you been?
The nurse informed me that I had high blood pressure and that my urine tests results were abnormal.
Do you have a headache or blurred vision?
I have a frontal headache and I feel irritable.
Now have gestational age is 38 weeks. How have the fetus moved lately? Is there more struggle?
Well, lately I have noticed that my unborn baby has moved a lot more and has been struggling a lot.
Let's check your abdomen. Sorry. Your fetal size is normal and fetal heart sound are well, but you have the sign of severe preeclampsia. I will give you admission to a delivery room and take magnesium sulfate for treatment.
Preeclampsia is a malfunction of the implantation of the placenta, of the endothelial tissue, and constriction of blood vessels, in which high-risk pregnant women, such as adolescent pregnant women, first trimester women, and women who are overweight, have high blood pressure, systolic pressure more than or equal to 140, diastolic pressure more than or equal to 90 mm mercury, with urinary protein more than or equal to 0.3 gram in 24 hours, urine or urine dipstick +1, reflexes +1 +2, edema +1 +2, and occurs in more than 20 weeks of gestation. Severe preeclampsia. The accompanying symptoms were systolic pressure more than or equal to 160 mm mercury, and diastolic pressure more than or equal to 110 mm mercury. Urine protein leak more than 2 grams in 24 hours. Urine or urine dipstick +T +4. Reflexes +3 +4. Edema +3 +4. And high blood pressure affects the heartbeat because when the pressure in the blood vessels is higher, the heart must squeeze more. This abnormality causes fibrosis to form in the heart. This is a factor that causes the electrical circuits in the heart to malfunction. During pregnancy, the amount of blood the heart pump or heartbeat increases by 30 to 50%. As the heartbeat increases, the resting heart rate increases from a normal pregnancy rate of about 70 beats per minute to 90 beats per minute. Physicians orders a magnesium sulfate infusion. As a nurse monitors Ms. JF, the nurse observes signs of magnesium sulfate toxicity. Signs of magnesium sulfate toxicity: deep tendon reflexes, loss of deep tendon reflexes 9.6 to 12 mg per deciliter, more than 7 milliequivalent per liter, respiratory depression 12 to 18 mg per deciliter, more than 10 milliequivalent per liter, and cardiac arrest 24 to 30 mg per deciliter, more than 25 milliequivalent per liter. Auricular of less than 30 cc per hour is used as a determinant for withholding a scheduled dose in order to prevent toxic levels. Severe hypertension. Magnesium sulfate may attenuate blood pressure by decreasing the vascular response to pressure substance. Available as antagonist calcium gluconate. 4 hours later, a serum magnesium level is down, and the results show 7.8 milliequivalent per liter. The nurse reports to the physician to prepare for treat magnesium toxicity. The antidote for magnesium toxicity is calcium gluconate 1 gram IV over 3 minutes. The magnesium sulfate infusion rate is reduced, and an oxytocin infusion has been ordered by the physician, and is being given IV in increments to achieve an adequate contraction pattern. The midwife noticed on the fetal monitor script that Ms. JF is experiencing 7 uterine contractions in 10 minutes, over a 30 minutes window. With a few fetal heart rate deceleration notes, the midwife comes into the room. Fetal decelerations refer to temporary but distinct decreases of the fetal heart rate, identified during electronic fetal heart monitoring. Electronic fetal monitoring is used to record the heartbeat of the fetus and the contractions of the mother uterus before and during labor. There are 4 types, including early deceleration, variable rate, and prolonged deceleration.
What is your name?
MJF.
Okay, I will stop to take oxytocin because you have a sustained muscle contraction evoked when the motor nerve that innervates a skeletal muscle emits action potential at a very high rate, titanic contraction, and you should be lying on the left side, okay?
JF progresses in labor and at 4 cm dilation, her membrane spontaneously rupture. The small amount of amniotic fluid is green. Was made of green amniotic fluid. Amniotic fluid that tinted brown or green means your unborn baby has passed meconium, their first poop, in the womb. Meconium in amniotic fluid can cause complications if baby breathes it in. In severe case, your baby may develop meconium aspiration syndrome and need immediately treatment after birth.
Your baby is a boy, his weight is 6.8 ounces. Congratulations!
Wow, he's so cute. Okay. Ma'am, hi, what is your name? MJF. My name is Tia Moss Lititian. I will advise nutrition for you. Water will moisturize the body and milk. Increase the amount of milk shooting about 10 to 12 glasses of water a day. Milk shooting increase 2 glasses of milk per day or 500 milliliters. Complete food in the 5 food, including meat, fish, liver, egg, vegetable, and fruit. Should take a balanced diet with optimal calories including good quality protein, calcium, potassium, vitamin A, iron, and folic acid-rich foods. Diet should contain an optimum amount of sodium. Avoid alcoholic beverages over caffeinated beverages and all types of fermented foods.
You're my honey bun, sugar plum, pumpkin. You're my sweetie pie. You're my cupcake, gumdrops, snickums, spickums. You're the apple of my eye.